Hello, good evening, sir. Suresh Dabu, sir, how are you? Hello. Sir, namaste. Good evening to you, sir.
Namaste. Yes, good evening.
Namaste, namaste, sir.
Nice to see you. Yeah, you're looking very fresh.
Thank you, sir, because of the environment. Okay.
Yeah.
So you are in London itself, sir, now also?
Yes, still in London for another month. Yeah.
Oh, great. Fine, sir. Nice. Okay. So today's topic was the concept of Rasayana and Rukshana. Do you know by the thing is that Rasayana means rejuvenation, Rukshana means scraping or lekana or fasting. All this signifies Rukshana. That is, if you want to paint a house, so you have to scrap the old debris. Then only you'll be able to paint a new one. So if you want to fix any regeneration thing, so first thing we have to detoxify. Then only what we can do the poshana or do the rejuvenation or energize the tissues, whatever it could be. So there should be a cleansing mechanism in this initial, then later on there should be energizing mechanism. So this is the principle of nature, where we will be able to understand whenever there is more pollution, what will happen when the rain comes, all the pollution will go off, so we'll get a fresh air. So the tree starts breathing, we get oxygen, and again we contaminate the air. See, this is the process of cycling process. In the same way, our body also adopts the same principle of cleansing. In a way, actually we get a disease in order to cleanse ourselves. See, if you get a fever, what is going to happen? See, you will not get appetite. So if you fall sick, in a way it is showing you that, so there is a requirement to remove the block. So nature is trying to remove the block whenever you get sick. So definitely what really we are doing, we are giving symptomatic treatment. The point where when we give symptomatic treatment, definitely what will happen, most of the time we are subsiding the symptoms. By the term itself, symptomatic itself, definitely it is for emergency. And you have to understand one thing, not all cases are emergency. And in that cases, what we have to do, let it exhibit the nature. What we have to do, we have to cordially adjust towards the our natural setting. For example, if we are being occurred by a fever, just suppose, so go for a fast, langanam paramoshadam, as I have told you. Second thing, take light food which will digest in easily. Second thing. And third thing, take such medicine by which our digestion capacity will be increased. So definitely what we are going to do is that, so we advise the people to take, excuse me, we ask the patient to take shunti, pippali, maricha, lashuna, guduchi, then whatever, deepana pachana, chitraka, sudarshana. So all these things, what it will do, it will increase the appetite. See what happens, the pitta has moved from the digestion towards the extremity. Now, so as the pitta has went outside, no pitta is there to digest your food. So definitely, so only we ask the patient to take low digesting food, one thing. So only you're giving the medicinal properties which is having the property to digest the things. That is, it will be acidic in nature. So today we are going to see which are all the foods which is having acidic, whether we have to take acidic food or alkaline food. What is the difference between these two and its implication in treatment? So all these things will be discussed today. So I think that where you will be able to understand much things in details. So moving into the slide share. Okay. So acidic and alkaline, the concept of Rukshana and Rasayana, the way of Dravya. This is what's our topic. And let's start to discuss. What is pH? First, you have to know, before saying what is acidic and alkaline, you should know the history of pH. So the concept of pH was introduced by Danish chemist. Okay. So what is P? Potentiality. What is H? Hydrogen. Means that potentiality of the hydrogen, the concentration or osmotic pressure of hydrogen. So when there is the presence of potassium, sodium, magnesium, calcium, there is the presence of H ion, which will make the food as alkaline, so which gives you more nourishment. And whenever you go for acidic food, it is definitely it produces free radicals. Definitely free radicals is essential to scavenge the bacteria and virus. So definitely each and everything is required. So in what way we can judiciously, that is by knowingly what type of food we can take. So you know that the pH of blood is how much? It's alkaline. So the organs which are working to make the blood alkaline are liver, kidney, all these are working synergetically. So now we have to understand what type of food if we are taking, it will be more easy to the patient who is diseased. So for the healthy person to maintain his health, how much amount of alkaline food is really required, all these thing if you are going to look, you will get a beautiful idea. So pH meaning I have told, as you can go through the slide, anyhow I will be giving these slides to you. Okay, so potential of hydrogen, the measure of acidity or alkalinity of a solution equal to the common logarithm of a reciprocal of the concentration of the hydrogen ion in moles per cubic decimeter of the solution. So pure water has got 7 pH. So when if you heat it, heat the water, what will happen? The pH will reduce. So only it is being told that if at all possible, if you are healthy, you take normal water itself. Do not boil it. So as you boil, it becomes acidic because the minerals in it, it has got natural minerals which will be gone off. As you remove the minerals, definitely the things becomes acidic. As you know that what makes acidic? Potassium, sodium, magnesium, calcium, and the presence of H ions make, or hydrogen ion makes the substance alkaline or acidic. So if it is acid alkaline means that will be more beneficial to you. So now coming to the next slide. So pH explanation, that's what I told you just now. I have told you all those things. So coming to the value of food, so you can go through. So which things which have how much pH in it. So moreover, if you take alkaline food, round about at least 60% to 70% for a healthy individual, that will be very nice. If he is suffering from cancer or any such serious problems where detoxification is very much required, so moreover, you plan your diet according to 80% alkaline, 20% acidic. So this can be done. So how to do that? You can go through that. See, if you take coconut milk, it is having 7 pH. It's very nice. Okay, next coming to next slide. Say in the same way, ginger, gooseberry, grape, honey. So you can just go through that. Here you can see lemon, the pH itself is 2.6, whereas when we take internally, it will be converted into alkaline. So definitely the Ayurveda has a concept of Ushnavirya and Shitavirya, which is very much well super explained. So what you take inside, if it is having exothermic reaction, or if it is producing certain type of heat, so that is, it is liberating the pitta out. If it is liberating the heat, so it is if it is able to dry up the things. If it is doing the karshana, then we tell it as Ushna Vipaka. If it is in the same way, if it is undergoing the what do you call Shita Vipaka, means Shita Virya, means what will happen? So the alkaline food is formed, so you get nourishment. So the kapha is formed, so you get revitalized. So all these things we can understand in the concept of Ushnavirya and Shitavirya. How the people like how the like how the dravyas, each and every dravyas acts. So even though you might see the good old the Rishi Maharshi had the beautiful concept of analyzing each and every plants and each and every things which we are eating. So definitely, even though with all these modern parameters, we will be able to understand, we will be able to appreciate the knowledge of the Rishi Maharshis. So definitely, so after hearing this topic, you will be able to understand the concept of Ayurveda is really for it's time-tested medicine and definitely it works. So only you have to stick on to the basic concepts of Ayurveda. So it is recommended that you test your pH level to determine your body's pH need. Immediate attention, like by using pH strip test, litmus paper, what we can do is you can what do you call like if you can determine your pH, it's easy. The best time to test your pH is about 1 hour before the meals and 2 hours after the meals. Like you can test your saliva. So what is the pH of your saliva? Based on that, you will get more evidence. Like simple, take a litmus paper with like within saliva. So while generally more acidic than blood. So what it happens, why it is having more acidic than blood, saliva pH mirrors the blood and tells us what the body retains. It is fair indicator of the health of the extracellular fluids and their alkaline mineral reserves. The optimal pH of saliva is 6.4 to 6.8. A lower reading than 6.4 is indicative of insufficient alkaline reserves. So you have to understand, if it is going acidic and acidic, so it's more possibility of having the alkalinity. So alkaline reserve, that is a reserve of calcium, potassium, sodium, magnesium, which is really required. It is coming low and low. Okay, so a reading lower than that, I have told you. After eating, the saliva pH should rise up to 7.5 or more. To deviate from a ideal salivary pH for an extended time invites illness. If your saliva stays between 6.5 and 6.7 all the day, your body is functioning within the healthy range. So after taking some food, so what we should happen, your saliva pH should increase. That is like it should increase like 7.5. It should become alkaline. Then only you are having the what happened. See, when the saliva is when it is being liberated with calcium, magnesium, sodium, it definitely becomes alkaline. So acidosis, an extended time in acid pH state. So it's an extended time where pH goes on decreasing. That is below 7, when it is goes down, can result in rheumatoid arthritis, diabetes, tuberculosis, osteoporosis, high blood pressure. Most cancers and many more are occurring because of this, our food system. See, what we can control judiciously is on only our food. So you take your food consciously, knowing what you have to take, that will decide you have to get sugar, BP, cancer, and definitely if you are having a cancer, if you are having a tumor, if you are having a BP, take the food judiciously rather than medicine. Because I have told you, I have keep telling you that a pill make you ill. A single pill, whichever that could be a pill, definitely it is a chemical. That could be Ayurveda, homeopathy, Unani, whichever the system. But definitely allopathy kills more bacteria and virus in the gut system. Definitely Ayurveda also and all the system does. But its first stage is the allopathy. So definitely I tell you, stop the medicine, whichever the system of medicine, live healthy and happily by judiciously planning what the food you have to take and what the mindset has to be. So that is the first and the foremost call. And if at all it is necessary, then only you should take medicines only for shorter duration of time. Getting the point. Next, coming to next point. So urine pH. So the pH of urine indicates how the body is working to maintain proper pH of the blood. The urine relieves the alkaline and the acidic metabolic cycle. The pH of urine indicates the efforts of the body via kidneys, adrenals, lungs, gonads to regulate pH throughout the by the help of buffer salts and hormones. Urine can produce a fairly accurate picture of body chemistry because kidney filters out the buffer salts of pH regulation and eliminating. Urine pH can vary around from 4.29 in extremes, but ideal range is 6 to 7. If your urine pH fluctuates between 6 to 6.5, first thing in the morning, and between 6.5 and 7 in the evening, that is before dinner, your body is functioning within a healthy range. Now we have to understand one thing. In the morning, the pH will be how much? It will be 6 to 6.5. That is at that time, that is kapha kala. So when in the evening means that is vata kala, that it becomes alkaline. So the judgment of Ayurveda, it is being told that te ahoratri bhuktanam te antya madhyadigaha krama. That is the first morning part, there will be increased of kapha, that is regeneration, revitalization. Even though you can see the asthma patient tend to increase their asthma, bouts of asthma during the 4 a.m. So whenever it comes to madhyana, that is afternoon, pitta will be more. Definitely whatever your gastritis, whichever the skin diseases, it will be flare during the pitta duration, that is afternoon. In the evening, whatever the osteoarthritis case, rheumatoid arthritis case, and whichever vata related, nerve related problem, the increase of pain usually goes in the evening. Now you have to understand the same way, 2 o'clock duodenal pain, that is the pitta kala. So only you are getting the pain. So in the same way, the regeneration, degeneration, also it's something called as Rukshana and Rasayana. This is the process of the body. See, we are regenerating every day as well as destruction. When this process does not occur, we tend to decrease in our health, start emaciating, we get cancer. Whenever the cells which is being formed, if it is not going back, if it is not dying, then we will be occurred with cancer. So definitely the process of Rukshana and Rasayana, it's every minute time. So it's happening each and every second. So definitely we cannot stop this. And why we are talking relating to this is, before giving some Rasayana therapy, rejuvenation, whatever that could be, vitamin or supplement, Chavanprash, so you should make sure that the patient having proper digestion. Without that, if you are giving any such heavy medicine, definitely patient encounters with more drastic problem rather than any improvement. So that only I am ensuring that there should be a proper absorption and assimilation. Then only you go for vitamins or whatever the regeneration therapy or anti-aging therapy or whatever that could be. So definitely for that example, I can tell you, in case when the patient is suffering from fever, if you are advised, like patient had come like I'm severe having knee joint pain. So if at all anyone suggests of applying oil and taking bath, what will happen? Definitely fever will flare up like anything. Definitely which would have been subsided within a day. It will not subside within a day. It will take 2-3 days further. So definitely by knowing the quality of nature, we can regulate the things. We cannot go against the nature. We can go along the nature. That's why we should know how it acts and what the things we have to suggest. So if you do this much, that will be a great deal. Okay, coming to the next slide. So urine testing may indicates how well our body is excreting acids and assimilating minerals, especially calcium, magnesium, sodium, potassium. These minerals functions as buffers. Buffers are substances that help maintain and balance the body against the introduction of too much acidity or too much alkalinity. Even with the proper amount of buffers, acids or alkaline levels can become stressful to the body's regulatory system. When the body produces too many of these acids or alkalis, it must excrete. It should excrete out. The urine is the method the body uses to remove the excess of acids or alkaline substances that cannot be buffered. If the body is buffering, system is overwhelmed, a state of autotoxication exists, and attention should be given to reducing the stress. So one thing I have to tell you in this case, see, what is auto intoxication? So you might tell me, by taking meat regularly, definitely there will be possibility of developing what? The acidic environment. But definitely one thing you have to remember, whenever your mindset is completely of anger, even though you take pakka pure vegetarian, okay, whatever the acid alkaline food, definitely there is possibility of developing auto intoxication, because manas has that much capacity rather than your food. So moreover, stress over to the manas, definitely food is a factor which we have to take consciously and judiciously. Even though if you forget the situation of manas, even though however you treat it, however you give the patya to the patient, definitely the patient is not at all going to recover unless and until he recovers, or he leaves the anger, he leaves the what you call kama, krodha, mada, matsarya. So what is happening in this world? So he has scored 90%, I should score 95%. So if that is a good amount of healthy competition, it's okay. So it's only my aim, if you go in that way, and what will happen, even though you get 95, and if anyone get 96, you will not be satisfied, and you start grumbling, shame, where that 1% had gone, I should have won over him. If all these things runs in the mind, definitely we will be we are making our body acidic, we are making our body to very susceptible to the cancer. So once it is happened, I had one patient, around 30 years old female. She came from Bangalore. So what actually happened, she had a esophageal cancer, 4th stage. So she was not able to take one drop of water from mouth also. So at this stage, she came where no surgery was being advised, no chemotherapy was being advised, as it is been spread all over, no chances of survival. So she came to me like that. So she was intubated from stomach, where she will be fed through the stomach pipe. So I inquired what actually happened, from what the manas, quality of manas. After seeing the nadi, I told some the factor of anger it is there. Why? And from since when actually you have started this? So she told to me, like, when I am married, like since 10 years, that is she married about 20 years. And she had the anger with the mother-in-law. So his husband did not follow her all those things. So she was very much angry towards her mother-in-law. So she started gastric. So each and every time she used to take Rantac and many other treatments. So what allopathy, Ayurveda, whichever treatment, that is not immaterial now. So the concept of manas, what happened? The quality of anger came. The anger made the acidic environment. So slowly she started this problem. Whenever she saw with 4 months back, she got scanned, and she got these things. And later on, the condition became very serious and serious. And only thing what I could do is that I told her, Are Baba, if at all, if you are not leaving your anger, at least by now, so what is the use? All things you have occurred only because of that. And by the miracle, within when she understood that, yes, and I have to change my thing and way of thinking, immediately within often of duration of time, she was able to take a glass of water. So it means that, so it's manas has that much healing capacity. So manas is not something as you think that it's not useless. Like manas, the prominence of manas, it's not at all giving in any system. So definitely homeopathy, Ayurveda also will speak about manas. Definitely in only in the respect to the medicine we are speaking. But definitely when you ask the patient and we consult the patient and we ask the patient to change the thoughts, and because of only which you're having the problem, so if you are guiding them, definitely that will create a great difference rather than any other medicines. So actually I would tell like that. So later on she recovered and she is better. Okay, so I wanted to tell you the significance of manas. Next, coming to the next slide, how alkaline diet works. So alkaline diets are popular choice for the people who want to achieve optimum good health. However, many people don't actually understand this diet, how it works. The concept is actually fairly simple. That diet just focus on regaining the balance that was lost when man started to eat more and more domesticated diet, pizza, burger, ice creams, okay, all those, so biryani, kebab, all those favorite delicious food. We want that delicious food. We are not able to control. If you see any such delicious food, what will happen? Even though we know that is acidic food, we tend to take 3 times a day all the acidic food itself, and still we want our health, we want to be healthy. So it's not possible. So whatever you want to take it consciously. So if you think that you want to get fall ill very soon, definitely you take and enjoy and die. So that's option is yours. How much time you want to live, so what type of thinking you need, all things rely upon us. The only thing is that I'm giving the suggestions, and if you take it, definitely that will be a great help for each and everyone. It's not only for the patient, it's for us. I'm talking for us, those who are in the group. So definitely it should help at least few peoples. So instead of focusing on foods that are high in sugars, simple carbohydrates are nothing but sugar. It's something like if you take 1 spoon of sugar, one chapati, it's one and the same when it enters into the stomach. So what will it creates heavy load in the arteries. So that creates the heavy free radicals. Free radicals will destroy your muscle, DNA, all the things, and definitely you fall ill. So definitely it should be only on 30-40%. Rest majority should be at least fruits, vegetables. How you have to take fruits? Should take only any fruits. For that matter, you can take the juices of vegetables freshly grown. So all this, if you are taking, definitely along with flaxseed oils, healthy oils like you can make coconut oil and the ghee, and all those things will be giving the omega-3 fatty acids, fish liver oil. All these things will give a good job. Next, coming to the pH level of the body has the ability to affect every single cell of the body. When blood has an alkaline pH instead of acidic, it will have a positive effect on how every body system function. The brain, circulatory system, nerves, muscles, respiratory system, digestive system, reproductive system, all benefited from the proper pH level. On the other hand, when the pH of the body is too acidic, it is susceptible to many diseases and problems. Weight gain, heart diseases, premature aging, fatigue, nerve problem, allergies, muscle disease, cancer are all more prevalent when the body pH is not optimum. Now, to understand one thing, whenever your patient comes, ask the patient to have proper patya. So only it is being told that they follow the nidana parivarjana. Whatever it is causing you the problem, you have to leave that. It's not that take one magical pill and your cancer is gone, or your sugar is gone, or your problem is gone. So you have to tell that. So detoxify your thoughts by Sattva Vajaya Chikitsa, which I have told you in my YouTube channel, and detoxify with the food and with the proper exercise and proper meditation, and patient can come back to the normalcy. Okay, understood? So it comes with beans, vegetable and legumes. So we are running out of time, only 9 minutes more. So I will finish within 5 minutes. If at all any question you can ask, or else we can wind up the program. So beans, vegetables, legumes, so which are very much high alkaline. Vegetable juice, okay, spinach, broccoli are alkaline. So alkaline is carrot, green beans, all these things are alkaline. Low alkaline is asparagus, okay, fresh corn. So you can just go through this. And also in the fruits also it has been well written. Grains, meat, eggs, nuts, oils, beverages, sweeteners or condiments. So note that food's acidic or alkaline forming tendency in the body has nothing to do with the actual pH of the food itself. For example, lemons are acidic. However, end product they produce after digestion and assimilation are alkaline, which I have told vipaka. That is what it converts. That is Ushna Vipaka or Madhura Vipaka or Ushna Vipaka. So likewise, meat will test alkaline before digestion, but it leaves acidic residue in the body. So like nearly all animal products, meat is classified as acid forming. So definitely stop going to the burger, KFC, chicken regularly, only monthly once or weekly once, if at all, if you want to be healthy. If you take regularly, what will happen? And you know, I did not tell what will happen. So more possibility of getting all sorts of diseases is very much high. So it's important that your daily dietary intake of food naturally adds to balance your body pH. To maintain health, the diet should consist of at least 60% alkaline forming foods and at most 40% acid forming foods. Definitely we require acidic forming foods. I'm not against it, definitely not, but in a lower range. To restore health, that diet should consist 80% alkaline. When a patient of cancer comes to you, or PCOD, or some tumor of fibroadenoma of breast, or tumor of what do you call uterus, or some testicular epididymis or something like that. So go for advising the patient 80% alkaline and 20% only acid forming foods. So why acidic? That's I have told you. In order for the body to remain healthy and alive, your body keeps a delicate and precise balance of blood pH 7.365, which is slightly alkaline. The body does whatever it has to do in order to maintain this balance. So what will happen if you take more acidic things? Your kidney, your liver, your GI system suffers from major destruction. Your bacteria and viruses will destroy in the acidic medium. So the things which is going to digest your food is the microbes, which is having 32,000 trillions and trillions of bacteria and virus, which weighs 2 kg of body weight, is there in your body, which is maintaining your health. So as I told you, the patient who has suffered from 4 months taking antibiotics, so suffering from what you call typhoid. So he was not able to digest even apple. It was going in that feces in the same way as the apple itself. So when I asked him to take kanji and buttermilk and all such good bacteria forming things, and the problem was solved. So now we have to understand, even though and however your liver, kidney, everything is okay, without having your good bacteria in your gut, definitely you will not be alive anymore. Definitely. So do not kill any bacteria, virus simply unjudiciously without knowing. Do not take antibiotics or any other medicines for that matter. That will destroy your gut. So it happened in London. So one of my friend works there as a professor in Cambridge University, where he tells for up to 5 days, if the patient got fever, means they will not give any medicine. So not even paracetamol, that too very, very minimal dose they will be giving. So what they do after the 5th day, they go for blood and culture sensitive test and see whether it is really required any antibiotics, and give the lowest and least sensitive antibiotics. Henceforth, what is happening? The antibiotic resistance is very much low. So whereas in India is the highly popular in taking second highest popular taking antibiotics, where we are, even it has been told that even the drugs of the TB are not at all acting. It has become super drug resistant and it's not at all acting. Since 25 to 30 years, we have not found single antibiotics till now. So we are using 30 years past antibiotics, and whatever we are having typhoid, whichever the bacterial and fungal infection, it's really outdated. It has been has crossed thousands and thousands mutation, and we still are using the same old drugs, which is definitely harming your good bacteria and virus, not helping to treat or cure any other disease or infection. So the antibiotics are really outdated fashion. So definitely you have to think, and if at all, if you want to preserve, stop taking antibiotics and turn towards the nature and follow the nature rules, so that if at all, if it is really required, if you want to take, in the case of septicemia and many such dreadful condition, we require antibiotics, and I am not against it. At least I am giving a call to save and preserve the antibiotics. Because if for each and every sneezing, for each and every common cold, if you keep on taking the antibiotics, definitely the resistance will be gone. Multi-drug resistance will be coming. So definitely do not do that. That is the one and first and foremost thing I would like to request you. So when your blood is clumped together, it has no when the alkaline medium, acidic medium occurs, your blood is clumped together. So it no longer can get into a little capillaries and in your body to give a oxygen. So all the stroke and everything is happening. So for each and every disease, manas as well as our diet is definitely a real cause. Okay. So there are many things which I could tell you. So since the shortage of time, I think we can wind up. What are antioxidant, free radicals, importance of all those things, it has been told that. So, and many things are there. So any doubts, I think in next class we can deal the rest of the things. Anyhow, we are left with only 2 minutes. Any questions to be asked, you can ask, or else we can wind up this session. It's over to you. And if at all any questions still persist, we can log into one more Zoom where I have given the link, and you can ask the question there also. Anyone? Anyone would like to ask any questions? If no questions, we'll wind the program here itself. If you want to discuss anything, we can make use of the time.
No questions, doctor. Thank you very much.
Okay, thank you. So have a wonderful time. Have a good day. Thank you so much. I think, hope you all enjoyed the session. Okay.
Yes, sir. Thank you very much, sir.
Yeah, keep supporting me.
Sure,
Okay.
sir.
Thank you. All the best. Bye.
Thank you, sir. Thank you very much. Very useful session.
Thank you, madam. Thank you so much.
Thank you.
Bye.